Welcome to 22 and 23. Today's topic is orgasm problems for male anatomy. So most people who think about orgasm problems with male anatomy automatically think erectile dysfunction or the problem of achieving or maintaining an erection. Sometimes it's also that people have a hard time orgasming, but for the most part, ED is going to be the main thing that people think of when they think about orgasm issues. There are a variety of things, both mental and physical, that can cause erectile dysfunction in someone. In a younger population, the cause of erectile dysfunction is generally going to be a bit more mental, is not the right word, but more in your head, anxiety around the performance, versus as you get older, there are a lot more things that contribute to erectile dysfunction. In younger folks, it's generally going to be things like depression or anxiety, performance anxiety, as well as there are some anatomical things like peyronie's, which is a like an uncomfortable curve in the penis, and then also things like medications, typically antidepressants. As you get older, it turns to the long-term consequences of some things that we might do to our bodies, like smoking, obesity, high blood pressure, sitting for prolonged periods of time. A lot of bikers actually can have some issues with erectile dysfunction as well. Heavy use of alcohol or drugs, and then no matter what your age, relationship issues. Based on this long list, it really depends on the cause how you address it. But again, for most younger people, it's going to be more of the mental health, medications associated with that, relationship, and then a few anatomical things that contribute to erectile dysfunction or problems with orgasm. So, on to your questions. Oh, this first one's a semen concern. Is semen supposed to be thick, white, and sticky, or should it be clear and thin? Does it mean there's something wrong with my sperm? Okay, so semen appearance can vary depending on your hydration status, how many times you've ejaculated recently, and so it can look like either of those really, and it's not necessarily a reflection of your sperm quality. So semen is more the fluid that carries your sperm. Sperm comes from your testicles, semen comes from some other glands downstream of the testicles, and so it kind of depends on, again, hydration, how many times you've ejaculated recently, and really shouldn't have much reflection on your sperm quality. So you might get thicker, whiter one day and clear fluid the next. Just depends. The only way to really know the quality of your sperm is to get testing. Question number 2. Many of my partners react in a negative manner when I don't come after a short period of time. Some have felt that there is something wrong with them or with me. I finally found someone who had the patience to let me be safe and doesn't make me feel insecure. I hope you can make more posts about this to help guys like me and know they aren't broken. Thank you for bringing this up. I 100% agree with you. There is such a bias, especially in younger men, the assumption that orgasm should be quick and easy and happen very quickly. And what you bring up is a very valid point, that that's just not always the case, and that is also okay. It does not mean that there is anything wrong with the person or with the partner. In fact, as I was alluding to before, relationships really are a big factor for sexual comfort, for sexual pleasure, for many people, no matter what your anatomy. So thank you for bringing this up. If it takes you longer to orgasm, it does not mean that there is anything wrong with you or how attractive you find your partner or anything along those lines. Always, if you have concerns about it, talk to your doctor, but just because it takes someone a little bit longer does not mean there's anything wrong with them. So thank you. Question number 3. My partner and I are 100% happy and and he's very attracted to me, but sometimes when we have sex, he goes soft and can't get it up. He thinks it's a blood pressure or testosterone problem. Is there anything else it could be? So it could be that. It could be a lot of things. So I appreciate that you sound supportive and, oh, not getting it up today? We don't have to do it today. Or you want to just take care of me. There are a variety of ways to address when things don't go up and someone's in the mood or someone's not in the mood. But if he's concerned that there's a problem, certainly talk with a doctor. There are a variety of things, like I mentioned in the intro, that could be contributing. Question number 4. I'm having regular sex with this girl, but I can never come with her, but I come when I masturbate. I don't know if she's not tight enough or if I'm just not physically attracted to her. What's the problem? I don't know. But tight enough is not a thing. Tight enough is not a thing. That being said, it is generally easier to masturbate and orgasm than have sex and orgasm, because with masturbation you know exactly what feels good and you do it and then you orgasm, versus when you are with someone else, there are a lot of different things that go into it. And so try different positions, but I wouldn't blame her, okay? Talk with her, try new things. Question number 5. Can you give me advice on erectile dysfunction? Sure. Talk with your partner. Talk with your doctor. Like I said before, there are a lot of things that can contribute, and oftentimes it's also in your head, or like you have anxiety around this. So talk openly with your partner, don't panic, and then talk with your doctor. Question number 6. I can't seem to be able to ejaculate when I have sex, oral sex, or get a hand job. Only when I masturbate. Is that normal, or is there something wrong? So again, masturbation is self-pleasure, and you know what feels good to you, and you can achieve it pretty quickly. Versus when you're with a partner, sometimes it takes a little bit more work, and that's okay. There's nothing wrong with you. I would encourage you just to start or continue communicating with your partner what feels good, what doesn't, and yeah, I would say, but nothing's wrong with you. Pretty normal to be able to orgasm faster with masturbation than with other acts of sex. Question number 7. When I'm intimate oral sex with my boyfriend, he can't finish. Should I be worried? No. So this kind of goes back to that second question about it's okay. There's nothing wrong with your partner, and there's nothing wrong with you. I would encourage you to talk to him, ask about what feels good, and what he might be interested in trying, and if he's enjoying it. The process of sexual pleasure, I mean, yes, the ultimate reward, the ultimate stop is orgasm, but it's also possible to enjoy the process and the experience. And maybe he's enjoying it and he just doesn't feel the same pressure that you do to orgasm as quickly as possible. I would talk to him, say, hey, I noticed you have not been able to orgasm when I give you a blowjob, or yeah, a blowjob. Is that okay? Or is there something you'd like me to do differently? And he might say, totally fine. I enjoy it and everything about it. Or he might give some different things that he might want to try. So don't sweat it, talk to him. Question number 8. What happens when a male orgasms but there's no semen present? So similar to sort of the question about semen consistency, the quality of semen can certainly be impacted by hydration status, by recent ejaculation. And so if someone has been ejaculating a lot, it's possible that there might be minimal semen. Even with processes like vasectomy, there can still be semen. So there's not anything necessarily anatomical. If you have never produced semen, talk to your doctor. But if it's just an every once in a while thing, it's probably related to hydration, if you've recently orgasmed, stuff like that. Question number 9, can men have multiple orgasms? Yes, but the recovery time between orgasm for male versus female anatomy is longer. So female anatomy allows someone to continue to engage in sex and possibly have another orgasm very quickly, versus someone with male anatomy, it's generally the ejaculation, blood flow has to calm down, and then you can try again later. So yes, it's possible to have multiple orgasms. It just takes a little bit of recovery time between. Question number 10. I put this in here because it is related to what arouses you and can cause orgasm. So question 10. I have a foot fetish. I like my girlfriend's feet more than her vagina, and most of my sexual pleasure involves her feet. Is this normal? Again, the question about normal. Is it average? No. Is it okay? Yeah, it's fine. When it comes to fetishes or things that turn you on, communication and making sure that activity is consensual, meaning that both of you want to participate, is very important for any acts of sex, and then also with any sort of interests or special interests or fetishes. But it's fine. It's fine. Different things arouse different people. So, cool. And that'll do it for this round of 22 and 23.